Previous lecture we discussed about mitral stenosis introduction, pathophysiology, and clinical feature. Clinical feature again we repeat just like dyspnea on exertion, dysphagia, ओसोफेगस कंप्रेशन के कारण डिस्फेजिया होता है, हेप्टोसिस, होर्सनेस ऑफ वॉइस, डिस्फेजिया, पाल्पिटेशन और चेस्ट पेन. Then sign of mitral stenosis. First sign seen in mitral stenosis is the malar flush. Second sign is the low volume pulse. Third sign is the atrial fibrillation. Again we repeat sign of mitral stenosis is the molar rash, low volume pulse. Third is the atrial fibrillation. Then on auscultation, ES1 is loud. Austin Flint murmurs is seen. Carry comb. Third is the gram still. All the murmur sound are diastolic murmur. All the murmur sound are austin flint murmur, carry comb, gram still. All murmur are is the diastolic murmur. Opening snap present. When valve is calcified, S1 is soft. S1 is soft and left parasternal heavy. Due to right ventricular hypertrophy. Gram still murmur due to the pulmonary irrigation. Now investigation of the mitral stenosis in ECG. Seen right ventricular hypertrophy, left atrium enlargement, second investigation is the chest X-ray. In chest X-ray seen left atrium enlargement. Second is the evidence of mitral calcification. Third is the evidence of pulmonary edema. Fifth is the pulmonary vascular congestion. Sixth is a Carly B line. Third investigation is the echo. In echo, hockey stick appearance seen. In echo, hockey stick appearance seen. Here, it's a hockey stick appearance seen. Note: for all valvular disease, best initial test is a echo. And accurate test is a catheterization. For all valvular disease. It's a MCQ point. Now classification of mitral stenosis. Normal mitral valve area is the 4 to 6 centimeter. Then, if mitral valve area is less than 2.5 centimeter, then progress to the mitral stenosis. Now classify the staging of mitral stenosis is done. If mitral valve area more than 1.5 centimeter, then it leads to the called as the progressive mitral stenosis. If mitral stenosis area is less than 1.5 centimeter, then it's called as the severe mitral stenosis. If mitral valve area is less than 1 or 0.6 centimeter, then it's called as the very severe mitral stenosis. Now we management of mitral stenosis. Management of mitral stenosis is, now if patient is asymptomatic, then we advise the patient avoid any heavy exercise for and low salt intake and low water intake. If patient is symptomatic, then we treat it with digoxin and diuretics. Digoxin we give if patient is atrial fibrillation or congestive heart failure, then we give the digoxin. If medical treatment is despite and symptom is persist, then we plan surgery. And endocarditis prophylaxis given before surgery. Before we plan surgery, then we give endocarditis prophylaxis. Now we plan surgery. Percutaneous balloon valvoplasty, open and closed mitral valvoplasty and valve replacement is the surgery of mitral stenosis. Then we use two type of prostatic valve in mitral stenosis: mechanical and bioprosthetic valve. Mechanical uh, mechanical prostatic valve, its example of bileaflet, monoleaflet and Kagge valve is the example of mechanical prostatic valve. And stentless, stent transcutaneous is the example of bioprosthetic valve. It's all about the mitral stenosis. Thank you for watching this video. Again we see in next video.